The tests are happening. The target was hit. But this isn't just about numbers. It's about who is being tested and who isn't. The promise of testing for everyone in every care home in England seemed clear and simple. We were told tests would be available for all staff and residents, not just those with symptoms. But last night on this programme, we showed the reality facing a care home in Burnley, where they're caring for people with COVID-19 and battling to get tests. And it's clear, many care homes face the same problems.
The care homes now seem to be the new epicentre of it.
Jagjit Singh runs a care home in Pontefract in West Yorkshire. He's having the same battles over testing and told me this needs to be the moment when social care gets the attention and resources that haven't always been there.
You know, it's our parents, it's our grandparents, it's our uncles and aunts. So surely the social care system should be treated with a bit more dignity and a bit more respect. And we are getting the impression that residents in care homes are just being seen as someone we can just forget. Otherwise, why is that testing not available? You know, it's crazy. And we're saying that we've got 100,000 tests a day, and we still are not being told that where we're going to get these tests from.
We've seen emails that show the kind of problems being faced by many care homes as they try to get tests. One email from Public Health England to a care home says they can have tests for any residents with new symptoms, but doesn't say anything about those without symptoms. Some care homes are being told to talk to the CQC about testing. The CQC has told us that their role is about administrative support. What sounded like a clear and simple promise doesn't seem to be clear or simple in practice.
But unfortunately, the rollout of this is not nearly as smooth as we would hoped it would be.
Professor Martin Green is the Chief Exec of Care England and represents almost 4,000 care homes. He says the situation is urgent and the promise by Matt Hancock must be acted upon quickly. And if we don't get what you say we need, what do you think the consequences will be?
The consequences will be further outbreaks in care homes of COVID-19 and the catastrophic impact that's going to have on the people who live in care homes, their families, and also the staff. This is a high-stakes business, and that's why we need to have a very clear response from government, and it has to be a proactive response, and it has to be systematic around testing.
The Department of Health and Social Care says mobile testing units are going to care homes and that the expansion of access to testing is protecting the most vulnerable.
The Department of Health and Social Care has told us this evening up to 30,000 tests a day will be made available for staff and residents at care homes in England, and we'll have more on the crisis in care homes later in the programme.
Well, let's return now to the epidemic in care homes and the difficulty with getting testing for asymptomatic people, both staff and residents. I've been speaking to Helen French, whose mother, Veronica, is in a care home in Liverpool, and I started by asking her how she was.
I feel helpless. I feel scared. The anxiety levels is just gone through the roof. I know the care home are doing the best, but they need the help, they need the support from the government, which is not happening at the moment.
What do you think needs to happen?
What needs to happen is that they need to get in there and test everybody. They need to get in there and test everybody, and they need to test the staff every day, because you just don't know what's happening.
How much contact have you had with your mum, and how is she?
I haven't physically seen my mum for 9 weeks now. I do get a FaceTime with her twice a week, but it's just not good enough. I need to actually physically be there with her. And the longer that this goes on, you know, I'm getting really worried. I'm getting worried about her health. I know she's being looked after properly, but I don't know about this COVID, and I don't know how it might go through the home.
It must be very frightening for the people in the home as well. I mean, does your mother understand, for example, why she's in isolation?
Not really, no. But I've just asked her to stay there because it's for her own benefit. Because I don't know if she goes into the general population, whether anybody in the home is asymptomatic, that you may pick something up.
I know you've written to Matt
Yes.
Hancock yourself. What have you said to him? What's your message?
I've said to him that he said that all the staff are to be tested and it's not happening, basically. And I've written the same to the MP, the same to Joe Anderson, the same to local authority.
Are you in touch with any other families as well? I mean, do you know how many other people are in your situation?
Yeah, there's about 45 people in the care home. 3 have died of COVID and 2 have died of natural causes. So it's actually been in the home, but the staff have just worked horrendously to try and get everything under control. And I'm so grateful to them, but they need help.
Well, Helen, thank you very much indeed. Helen French, thank you very much for your time.
Thank you very much, Channel 4. Thank you.
Well, joining me now is the Shadow Minister for Health and Social Care, Liz Kendall. Are you calling now for asymptomatic staff and residents in care homes to be tested by Public Health England in the same way as those with symptoms?
Yes, and we have been for some while. And I think what you've heard today is we are a long way from achieving that. A survey today from the National Care Forum found that only 1 in 5 care workers have so far been tested, and that's those who actually have symptoms. So to get to the situation where all residents and all care staff, whether they've got symptoms or not, are regularly tested, we are a long way from that. And I think ultimately where we need to get to is that families can have the testing and PPE they need so they can go and visit their loved ones. You heard Helen say there, she hasn't seen her mum for 9 weeks. That must be unbearable when she's so worried. So a proper strategy for social care would make sure all residents, all care workers, and ultimately families can get the PPE and testing they need.
We saw Keir Starmer telling Boris Johnson that the government had been slow to test, slow to trace, slow on care homes. I mean, isn't the truth that Labour has been slow on opposition? You were so busy trying to be sort of constructive for months that you have really failed to point out what the government hasn't been doing.
I don't agree with that. And actually, right at this minute, I want the government to succeed. I want them to succeed on PPE and testing because I want to do everything I can to help them.
Of course, but it's your job as opposition to tell them what they should do, as you just have now on care homes. And, you know, I don't remember Labour politicians jumping up and down in February or early March saying, lockdown now, test and trace, follow South Korea. Isn't it easy to sort of accuse the government of being slow after the event?
Well, actually, MPs were raising at the last Prime Minister's questions that Boris Johnson did, the very issue about testing and PPE in care homes. And I myself, even before I became the Shadow Care Minister, have written regularly to Matt Hancock about these issues. You know, I know a lot of people rightly feel angry and upset about what's happening. So do I. But we have got to get the government to succeed here. And so that's why I'm putting forward practical proposals about how we get more local testing centres, mobile testing and testing sent to carers' own homes, why we have to get the NHS to provide more support for care homes, why we need intermediate care so that people who are discharged from hospital who've got COVID-19 don't have to end up going into a care home if they can't be isolated and where the risk of the virus spreading is so high. And it's why I've suggested the government appoints a new chief care officer to sit alongside the chief medical officer to make sure that at the very top, social care is getting the focus and priority it needs. Look, there will come a time in the inevitable public inquiry where serious questions are asked about why the government has been so slow in focusing on this absolutely crucial issue of care homes, particularly when we saw horrific evidence much earlier from other countries. But right now, we need to save lives and stop the spread of that virus and help care users.
But we also want to know whether politics really has been cross-party. I mean, if you're concentrating on making helping the government succeed at the moment, how much has that actually happened? Has there been a meeting between the different teams? You know, have you sat down with Matt Hancock's team or your opposite number at all? Have you sent them suggestions?
Every week since I've been appointed as the Shadow Care Minister, I've had a Zoom meeting with the Care Minister where I've listed all the sets of my concerns, and I followed that up in writing and published my calls for further action. You know, that's what I want to do as a member of the opposition who wants to focus attention on problems and try and come up with positive solutions. As I said, people are understandably angry and frightened and anxious. We've got to try and put this right, and right now, that's got to be our focus.
Liz Kendall, thank you very much for joining us.